Charles is a hardworking man from Pennsylvania.
I'm a family-based therapist. I travel to homes of troubled youth and families and help them work through their issues. My favorite thing to do is ride my Harley. So I love riding. My wife likes to ride with me as well, and we spend a good bit of time doing that. I was a coach for a lot of years, so I'll go watch hockey games or football games. I don't even have to know the kids. It's good to see healthy kids playing healthy games because my job is working with kids that aren't healthy. So I enjoy doing that with a couple buddies of mine that I coached with through the years.
While Charles works as a therapist now, he previously spent time working in the coal mines, where his job required him to lift and operate heavy equipment. As the years wore on, it began to take a toll on him physically, until one day he injured his back while working around his home.
We built a new house and we were putting a retaining wall in. I was a busy guy at that time. I was actually talking on my phone. I had my phone stuck to my ear like this, and I was lifting up 90-pound landscape blocks, and I just felt a really nasty pop. It kind of put me on the ground real quick. I was down for a couple minutes and I got back up and kept doing it. Always had pain when I was walking, nothing that I couldn't handle because I'd been through so much pain my whole life that I just let it go.
Charles was able to push through the pain, but eventually had to seek medical attention. His hometown doctors advised him to undergo traditional open back surgery.
I had my first surgery in which they did two, I think they're called discectomies, and then one lumpectomy. That was about a 6-month to a year recovery.
A few years ago, Charles began experiencing weakness in his legs and a general loss of stability. Since he relied on his motorcycle to commute to work, it began impacting his ability to perform his job.
I first noticed it like in the weakness of my legs. My right knee would give out. I actually, at a stoplight or a stop sign, I went to put my feet down on my bike. My knee wouldn't hold me up, so it dropped. My legs didn't feel stable. I didn't feel balanced on the bike. I haven't been to a client's home since the beginning of December. So that's what it prevented me from doing. I couldn't go to the clients. My job has the advantage of being able to do online counseling, but anybody who knows anything about counseling, it's not the same. So I would have to do everything online or on the phone, and that's just not good for the kind of work I do.
Realizing he needed help and trying to avoid another open back surgery, Charles tried a number of conservative treatments to no avail.
Over the years, I spent a lot of time in chiropractic care. It would give me relief, and sometimes it would last longer than others. I wasn't going every week. I was a little bit concerned about, especially with chiropractic care, because they always want to twist you. The last time I went to a chiropractor, like in December, whenever it got really bad and I woke up and I couldn't really move and I was rolling out of bed and all the stuff that I had dealt with in the past, I went to a chiropractor twice. He made it worse. Massage therapist, just trying to deal with it. Even did a little bit of cupping around my hips, and that gave me a lot of relief. I thought that was going to be the answer to everything, but it would last a week or so, then it would go away. And that's when I knew, and I just stopped all of it.
When conservative treatments failed, Charles began searching for alternatives to the traditional open back surgery he had in the past. And that's when he learned about the Bonati Spine Institute from his wife's uncle.
We first heard about the Bonati Institute about 2 years ago. It's her uncle, my uncle too, came down for a procedure, and he had 2 levels done. When he was talking about it, I'm like, yeah, it probably wasn't a big deal. And like there wasn't as much damage. It was a different case, And so I paid very little attention to it. But her aunt came down in December, and she had been fused. And I'd watched this woman suffer with pain. I mean, she was walking with a walker or in a wheelchair. She couldn't go up steps. They had chair lifts in the house. Like it was a mess. And he actually removed the fusion. I think it was Dr. Bonati did hers, and when I seen her come back from that, and it was right around the time I was dealing with all this, she walked into her aunt, her other aunt's house, and was sitting there with not grimacing, not complaining. It was enough to convince me to, at least send the MRI and see what he has to say.
When Charles arrived for his in-person evaluation, he was provided a physical exam, had some additional x-rays taken at the on-campus imaging center, and a few minutes later, met with the surgeon to develop and customize a surgical plan to eliminate his pain. Hearing Bonati could help, Charles scheduled the first of his procedures for that afternoon.
It was pretty cool. I came here, my appointment was at, I think, 8 or 8:30. They took me almost immediately over for x-rays, brought me back, took me into a room. Nurses are talking to me, getting vitals and all that stuff. And Dr. Bonati walks in and he's like, you see this? See this? This is what's causing it. We're going to remove this and you're not going to have pressure there. And that's going to let the nerve operate as it should. And you're not going to have pain. And, so that made sense. And, within a half hour from that, I think I was on the operating table getting the first surgery done.
At the Bonati Spine Institute, surgeries are performed incrementally using conscious IV sedation, where the patient remains awake and communicating with their surgeon. This is to ensure the source of the patient's pain is eliminated before they leave the operating table.
I was a little bit worried about how I'd respond in that. It's still a little freaky feeling things get pulled and tugged and tapped and all that stuff, but I understand why they do it, because they want to make sure that the pain's not there. Lifting my leg the way I did off that table, I would have never been able to do that prior. And they had me doing like a kind of like a push up and arching my back. Again, that wouldn't have happened. So they're testing it, and I think that's smart.
Okay, go up and down. Now it's different. Now you have to do it. Perfect.
I don't have any pain when I do it.
I want that you lift yourself and do a push-up. No back pain?
No.
You got it.
Patients of the Bonati Spine Institute are often surprised by how quickly they are able to be up and moving just minutes after their procedure.
The first surgery I had on Monday, I was up and walking. And then they told me to jog, and I thought they were out of their mind. And I haven't jogged in, I don't know, since probably 2015. I didn't know how to, you don't know, you never think you're going to do that again. So, yeah, it was pretty amazing. So, and I knew at that point, I was going to have, my quality of life was going to be better.
At the Bonati Spine Institute, patients are not required to wear uncomfortable braces or suffer weeks of agonizing physical therapy post-surgery. Instead, they are instructed to walk about 40 minutes a day.
The only physical therapy they've told me here is make sure you walk as much as you can.
Charles highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
The fact of the matter is I've already recommended Bonati Spine Institute to a coworker. So I called him last night. He's an older gentleman, and he's dealing with significant back pain. And I was trying to encourage him, just send the MRI down. That doesn't cost anything. Send it down, talk to the guy. If he says he can do something for you, listen to what he says. And if he can't, he can't. I mean, he's going to tell you. So, I would definitely recommend it to anybody.
Charles is looking forward to getting back on his motorcycle and enjoying time with family and friends.
I love coaching. I'm looking forward to grandchildren someday that hopefully will play hockey or softball or football or any of the sports that I coached, and I can be actively involved. That's a really important piece to me.
To see more stories of recovery just like this, search for the Bonati Spine Institute on Roku, Amazon's Fire TV, Google Play Store, and Apple's App Store.